birthplace team. I have a new vial of epinephrine, and I just wanted to go over how to open that, just because I know we don't do it very often, and it can be stressful when we have to open it. So the first thing is you want to make sure you have the correct dose of epinephrine when you're giving that. And it is the 1 milligram per 10 milliliter, or 0.1 milligram per mil. Now to open it, each box has an area that says open. And really, you can tear into this anyway, but if you open it correctly, it'll just come out of the box a lot easier. So if you just put your finger where it says open and open the box from there. Now just take them both out, both pieces. They have a cap on either end. So just pop one and then pop the other. You want to put it together, and just with a little bit of pressure, not too much, or you'll actually lose some of your medication. So I have it ready to go into my syringe. Now if I'm giving it through the ET tube, I'm going to want to use a 5 milliliter syringe. And if I'm giving it through the umbilical line, I want to use a 1 milliliter syringe. I do need to use a stopcock to get it from this vial into your syringe. With our stopcock, we just want to make sure that we have the male turned off. So there's 2 female ports, 1 male we want to have. We do not need him, turn him off. Then I'm going to give it through the umbilical line. So I'm going to use a 1 milliliter syringe. So it can really go into either port. Then I'm going to take this cap right here off, and I'm going to put it into the other one. And it just kind of screws in there. So I'm going to be giving it to this baby right here. Now this baby, if we were giving it, it would be getting chest compressions and ventilated at this time. So the estimated weight on this baby is going to be 2 kilos. So I'm just going to come over here and look at my chart. This kind of pink color right here is my 2 kilo baby, and it'll tell me all of my medications and the route. So if I'm giving it through the IV, IO, all I really care about is the milliliters. How much do I need to put into that syringe? And it is 4 milliliters is the recommended dose. So I'm gonna drop a little extra, because there's gonna be a little bit of air. So if you can push or pull or do a combination, and I don't have a lot of air in there, so I'm just gonna drop about 0.5, 0.6. Unscrew it. I'm gonna leave this because I may need to give multiple doses. So I'm gonna leave this like that. Just gonna get my air out and push it up to the 0.4. Now with NRP, we always want to have good communication. So my provider has asked me for this dose, and when I'm handing this over to my provider, I want to make sure that I'm saying it so that my recorder can document that. So I have 0.4 milliliters of epinephrine, and then when this needs to be given, so the umbilical line is already in. They primed it before they put it in. You've got your saline here that would just stay connected. This is going to be my medication port. So wherever the stopcock is pointing is off. So I want to turn my saline off. I'm going to rapidly give my my medication, and then I'm going to turn the medication off. And I want to see what's in my syringe, and I want to flush with 3 milliliters of this normal saline. And I'm going to look at my APGAR timer, and I'm going to say at 5 minutes, 0.4 epi given, because this medication can be repeated every 3 to 5 minutes. So I want to make sure that we know for sure when that was given. Also, if by chance it was given through the ET tube, you don't have to wait that 3 to 5 minutes. Really, this is the preferred route. This is what's going to work much better for your baby.